Welcome, everyone, to Mom Hacks and Tips. We have a topic today that's on the minds of so many hopeful parents. Can you really know you're pregnant before a missed period? We're here to explore those very early signs. Dr. Reed, are you ready to guide us through this exciting and often confusing time?
I am, Daniel. It's a privilege to speak with your audience about this. The 2-week wait can feel like an eternity, and having clear information can make all the difference.
For our listeners who are just meeting you, could you share a little about your experience and what makes you so passionate about supporting new and expectant parents?
Of course, I've spent over 15 years as a childbirth educator and doula. My work involves supporting families from the moment they decide to start their journey all the way through pregnancy, birth, and the crucial postpartum period. My passion comes from seeing parents feel empowered and confident when they have access to reliable knowledge and compassionate support.
Let's start with the most talked about sign. What are some of the absolute earliest symptoms of pregnancy that a woman might experience?
The very earliest signs are often subtle and can easily be mistaken for premenstrual symptoms, which is what makes this time so tricky. The most common one is a profound sense of fatigue. This isn't just your typical end-of-day tiredness. It's a bone-deep exhaustion that hits you early on, caused by the body producing high levels of the hormone progesterone to support the pregnancy.
You mentioned progesterone. What other hormonal changes cause symptoms, for instance, with breast tenderness?
Breast changes are another very early indicator. Hormones like estrogen and progesterone surge right away to prepare the milk ducts for lactation. This can cause the breast to feel swollen, sore, tender, or heavy. Some women also notice their areolas, the area around the nipple, becoming darker and larger.
We often hear about implantation bleeding. Can you explain what that is and what women should look for?
Certainly. Implantation bleeding is light spotting that can occur when the fertilized egg burrows into the uterine lining. This typically happens about 6 to 12 days after conception, which is often just a few days before you would expect your period. It's usually very light, pinkish or brownish in color, and doesn't last long, maybe a few hours to a day or two. It's much lighter than a typical menstrual period.
Along with implantation bleeding, can cramping also be an early sign?
Yes, mild uterine cramping can accompany implantation. These cramps often feel like light menstrual cramps, a dull ache or pulling sensation in the lower abdomen. It's the uterus reacting to the new tenant setting up home. If the cramping is severe, it's always best to check in with a healthcare provider.
Let's move on to the classic sign, nausea. How early can morning sickness really start?
Nausea can begin surprisingly early for some women, sometimes as soon as 2 weeks after conception. We call it morning sickness, but as many will attest, it can happen at any time of day or night. It's believed to be linked to rising levels of the pregnancy hormone HCG, as well as estrogen.
How does a heightened sense of smell relate to nausea and food preferences?
An incredibly sensitive sense of smell is a very common and early sign. Suddenly, the smell of coffee brewing or a coworker's lunch from across the room can feel overwhelming. This heightened sensitivity is often directly linked to nausea and can trigger food aversions, where foods you once loved now seem repulsive. On the flip side, it can also bring on specific food cravings.
Are there other, more subtle signs that women might overlook?
Absolutely. Bloating is a big one, caused by progesterone slowing down digestion. This can make you feel puffy and your pants a bit snug, much like right before your period. Another is frequent urination. As soon as pregnancy begins, the amount of blood in your body increases, causing your kidneys to process extra fluid that ends up in your bladder.
It sounds like many of these signs could be easily confused with an impending period. How can someone tell the difference?
That is the ultimate challenge of the 2-week wait. The key is to pay attention to what is normal for your body. If your premenstrual symptoms seem different or more intense than usual, or if you're experiencing symptoms you've never had before, it could be a sign. Tracking these changes can be very revealing.
You mentioned tracking symptoms. With so much to keep in mind, how can our listeners effectively monitor what they're experiencing?
Having a dedicated space to log everything is invaluable. This is where a tool like the free daily tracker on MyMiraclesPLAN.online becomes a new parent's best friend. You can note physical symptoms like cramping or nausea, but also your energy levels and emotional state. Having this record is incredibly helpful when you eventually speak with your doctor.
That's a great tip. Once a pregnancy is confirmed, the planning phase begins. What's a good first step for an expectant mother?
Knowledge is power, and it helps reduce anxiety. I always recommend getting a clear overview of the journey ahead. The pregnancy timeline on MyMiraclePLAN.online is a fantastic free resource for this. It walks you through each stage, explaining fetal development and what changes to expect in your own body, week by week.
Speaking of planning, what about the fun parts, like choosing a name?
The fun parts are so important for bonding and celebrating. It's a wonderful distraction from the anxieties. I actually had a couple recently who were feeling overwhelmed, and I pointed them to the AI name generator on MyMiraclePLAN.online. They said it turned a stressful decision into a fun and creative activity they could do together.
Beyond tracking and timelines, what about preparing for the baby's actual arrival and the time after?
Preparing for the postpartum period is just as important as preparing for birth. The website has an entire section on postpartum care, which is crucial. It also offers a comprehensive new baby plan to help organize everything from what to pack in your hospital bag to setting up your nursery. It takes the guesswork out of preparation.
It sounds like a true all-in-one resource. Are there articles or other informational guides available?
Yes, the site is rich with evidence-based articles and parent resources. You can find everything from natural recipes to help manage nausea to in-depth guides on newborn care. It's designed to be a reliable companion for parents at every single stage.
This early waiting period before a positive test can be filled with a lot of hope and anxiety. What is your most important piece of advice for women who find themselves in this limbo?
My most important advice is to practice self-compassion. Be gentle with yourself. Your body is potentially doing something miraculous, and that requires energy. Instead of obsessing over every twinge, try to channel your energy into self-care. Nourish your body with good food, get as much rest as you can, and find moments of peace, whether it's through a short walk or a few deep breaths. Whatever the outcome of this cycle, know that you are resilient and whole.
That's beautiful advice. How can a partner or support system be most helpful during this time?
For partners, the best thing you can do is listen. Create a safe space for the hopeful mother to share her anxieties without judgment. Offer to take things off her plate to reduce her stress. Go for a walk together, watch a funny movie. The journey to parenthood starts long before a positive test, and navigating this uncertain time together as a team builds an incredibly strong foundation for the adventure ahead.
Dr. Reed, this has been incredibly illuminating. To help our listeners recap, what are the most important takeaways they should remember about these very early pregnancy signs?
The three biggest takeaways are: first, early symptoms are real, but vary immensely from person to person and even from pregnancy to pregnancy. Second, many signs mimic premenstrual symptoms, so pay attention to what feels different for your body. And third, be patient and kind to yourself during the waiting period.
And for everyone listening who wants to access the amazing tools and resources we've discussed, where's the best place for them to go?
The single best place to go is MyMiraclePLAN.online. Everything we talked about, the daily tracker, the pregnancy timeline, the AI name generator, the new baby plan, postpartum care guides, and all the articles is there and completely free to help you feel supported and prepared.
Thank you again for sharing your wisdom with us on Mom Hacks and Tips. Do you have one final thought you would like to leave with our audience?
My final thought is to trust your intuition and honor this unique time in your life. The entire journey of creating a family is a miracle, from the first hopeful thought to holding your child. Embrace it, find joy in the little moments, and know that you are not alone. Thank you for having me.